Assalamu alaikum and welcome back, parents, to Parenting Hour. You're tuned into Unity FM 93.5 here in the West Midlands. And if you are tuned into Inspire FM, you are in Milton Keynes and Luton, tuned into 105.1. Welcome to this evening show, which we're talking about vaccinations. It is a pre-recorded show, and I'm here with Sharen and Yasmin, and we're going through a lot of facts. Of course, you know my name. I don't need to introduce myself now. My name is Kathleen. I've been hosting this show for over 12 years, I think about 13 years or so now, mashallah. And we really want to get across so much important information to you. And the best way of doing that is getting experts that we have this evening on the show to do that. And I know last week we talked about a dear sister who passed away, and she was amazing at getting information across to you also on the shows, and we'd like to just remember her again, Sister Alice Rasool, a health visitor that often came on the show, getting across important pieces of information, like what we're talking about this evening on vaccinations and the importance of doing that. So maybe keep her in your du'as, as we hope that, inshallah, Allah will elevate her to the highest status in paradise, inshallah. Ameen. If you were tuned into us, the first part of the show, maybe you went off and grabbed a pen and paper, or tried to record some of these things, because there's a lot of information, and you could get confused very easily about what's acceptable and what people do at different times. But both Sharon and Yasmin has said to us, just contact them. And if you have been outside the country and have had vaccinations different times, just call them, and we'll post their number soon to you, so you know who to call, so that you can get those records onto your records here in the UK, and make sure that you know of what is due in the UK, because we want to prevent outbreaks. We want your family to be protected. We want your children to be protected, parents to be protected, so that everybody that you know is protected in your household. And the best way is just discussing that, of if you have missed vaccinations, or if you've had vaccinations in your home country or in some other countries that you lived in, where are you in relation to the UK system? And talking about that, we were talking before the break, we ended about the flu vaccination, and we were talking about the importance of that. Maybe we'll just summarize that a little bit again about the flu vaccination before we go into the side effects, and talk about the side effects of that vaccination again. Sharon, I think you were talking a little bit there about the flu vaccination and what it does. Can you kind of summarize that for us a little bit again? We might have new listeners now that just jumped into the car and just tuning in now.
No problem, Kathleen. So the flu vaccine helps to protect against the flu. And this, unlike what people normally think, actually can be a very serious and sometimes life-threatening illness. It's far more serious than a common cold that people might think that they have. So the flu vaccination that we offer, it's offered every year from September to December from reception-age children all the way up to year 11. There's no cost, as Yasmin said early, with this vaccination, and it comes in two forms, either the nasal spray, which is a live vaccine, which is thought to be the most effective as it goes through your nasal passages, which is where the virus would enter, more effective and more longer lasting, and also the injection, which is not a live vaccine, but also protects you against the flu. The most common side effects of the vaccines are mild, and they do get better in a couple of days. They can include some pain, redness or soreness in the arm if you've had the injection. You might have a slightly raised temperature, and this would show that your body's reacting and making an immune response, which is what we want it to be doing. Your body could feel a little bit achy. Sometimes you can have a more serious side effect, as you can have with any medication, where you could have a severe allergic reaction or anaphylaxis. This is extremely rare. I've never seen a case in any of the children that I've vaccinated myself, but we always have trained personnel, nurses, support officers available at sessions with appropriate medications to deal with any allergic reactions. As I said, the injected vaccinations do not have a live flu virus in them, and they cannot give you flu.
That's really important. So it can't give you flu because some people are worried about that, aren't they? And they might get a flu after and they blame it on the vaccine.
And I think if you've already got some bug in your system and you're feeling unwell and it's trying to come out and it coincides with when you have your vaccination, then you automatically think it was the vaccine that caused it.
Mm.
But unfortunately, as the time that we're vaccinating, it is the time when the virus is spreading. But hopefully, if you do get it and you've had your vaccine, it will be milder and the symptoms will not last as long and avoid hospital admissions.
Mm. Some people also might put it off because of the worry that it contains gelatin.
It's only actually the nasal spray, Kathleen, that contains gelatin.
Mm.
And it's a purified form of porcine gelatin, which is just used to stabilize the vaccine. It's also used in many other medications. But the vaccine itself, as I said, the nasal spray is more effective and it does contain gelatin. But the alternative is there to have the flu injection instead in school or in clinic if that's what parents would prefer.
Wonderful. So that is there for them, and there's alternatives there for parents if they prefer. Because I know it's a little bit worrying for some of our communities around gelatin and what to do, and they would like to get the proper information for that. Really good for them indeed. So we are going through the vaccinations of the different ones that are happening, and I know that you mentioned a one called HPV. That's a big name to it. What does that stand for, and what does that do?
So HPV, Kathleen, stands for human papillomavirus, helps prevents against this virus, and it's recommended for children aged 12 to 13, older people at higher risk from HPV. This vaccine can reduce the chances of getting the HPV virus, and a common virus that spreads to the skin. So most HPV viruses are harmless, but some types are linked to an increased risk of certain types of cancers. So these types of cancers include cervical cancer, mouth cancer, anal cancer, penile cancer, vulval cancer, and vaginal cancer. And HPV can also cause genital warts as well. So this is the reason why we're trying to help protect the community from all of these cancers and viruses.
Well, that's a lot of different cancers there that you have to protect indeed. So it's a lot of one vaccine protects all of that together.
Yeah.
Wow,
So HPV is given in year 8 and year 9, and this is in schools. So we've just covered this program from January to April, and HPV is a vaccination that's given in the arm of the child, and there's only one dose that the child needs. And this vaccination, just to make it clear, is for boys and girls. As Sharon was saying earlier, that previously it was just for girls, but boys have been introduced since 2019, and therefore this vaccination is for both boys and girls. And again, this is free vaccination; nobody has to pay for it, and by using the Mavis consent form, children's parents can consent via the e-consent and get their children vaccinated. Any child that's missed the vaccination in from January to April, we do continue to catch them up. So we do, if they've consented, we will try and catch them up until end of August, so that we're making sure that they get the vaccination that they need and that they've consented to.
So you do that automatically through the school system because it might be off ill or something like that, and you
Right.
do that automatically. The parent don't have to worry about then because they've been ill to contact you. No, it's an automatic system from your side.
So
Sharon?
Anybody that's been absent from school, we will leave our contact details with the school,
Mm.
and they can give those out to the parents. However, if they don't come to clinic and we're going back into the school for another session with a different year group, then we would offer it at that time as well. So we would always endeavour, if there's a consent in place, to catch a child up whenever we have the opportunity.
Great, great. So wonderful support system there and make sure everybody has it. Is there side effects to this vaccine?
So it's very similar, Kathleen, to as I said earlier with the flu injection. You can get a bit of soreness at the site. You might get a bit of a headache or a temperature again. As we said, this shows you're making an immune response. Sometimes, though, with the HPV vaccine, because one of the side effects of it is it can have a drop in blood pressure, and sometimes it can lead to fainting. So if we're doing HPV at school, we keep all of our students for 15 minutes after they've had their vaccination, just to make sure they're fit and well. If they haven't had any breakfast or anything to drink on the morning of the session, the school are usually very good to provide us with at least water, sometimes biscuits, and then we would pinpoint those children and say, please, can you let them have something to eat and drink if they're feeling unwell, or advise them to go and get something as soon as they can after the session. And again, as I said earlier, if there's any type of anaphylaxis reaction, any type of allergy that occurs, we are fully trained to deal with that. And if need be, we can get the school involved, or if we needed outside assistance from any type of paramedic or any type of other service, then we would certainly do that as well.
And if they had some of those, sorry?
Sorry,
I was
Kathleen.
just going to ask if they had some of those things previously, that some of those allergic reactions or something like that, how would you deal with them in this situation?
So in the questions that the parents are asked, it's the specific questions around allergies. And if there's anything that pinpoints that it wouldn't be suitable for a child to have it, then like we said before, we'd get consultant advice or GP advice if it was appropriate to give it. It may not be appropriate to give it in school. It might need to be given at the GP or to be given in clinic. But in our monitoring period with children after the vaccination, anything untoward, any symptoms or a child feeling unwell, then the nurse would step in, the school would step in. We carry anaphylaxis kits with us, and we would look after the child depending on the severity of reaction. And obviously the parents would be contacted as well to let them know what the situation was. If a child's unwell, though, with a cough or a cold, it doesn't usually stop us giving vaccinations. It would only be if they had a high temperature, and then we wouldn't want to give a vaccine on top of that in case it masked the reason for the temperature in the first place. So then we'd offer clinic at a later date.
Okay, good, good. So, indeed, and I suppose you just see that, do you, from the way the child presents with you, and you can see if they're red and things like that, and then take their temperature, or else if the children are feeling unwell, you hope that they would come forward and say that.
And it's all it's part of our pre-screening, what we would call the questions that you have, the conversation you have with the child when they sit down next to you. How are you feeling today? If they're having HPV, have you had breakfast? Have you had something to eat and drink this morning? So it's just that curiosity and that care that goes into looking at the child that's with you and seeing how they are. Feeling a bit of a cough and cold, then we take the temperature, we'd record it, we'd have that conversation. You have got a cough and cold, there's no temperature present, we're happy to go ahead. Are you happy to go ahead also? And then if they did feel faint or unwell after the injection, as I say, it's pointing them out to the person who's doing the recovery, keeping them for 15 minutes, letting them know to keep an extra eye on them, get that glass of water or a packet of biscuits if need be, just to ensure that they're well before they leave the session.
Great. So there's great care around that and looking after them and being specific, and what you're doing. Brilliant. I suppose some of them still may be worried, some of our community in particular, and we're talking about vaccines, and I know we talked about gelatine there before the break, or actually just after the break, we talked about gelatine in relation to the flu vaccine. But in relation to the other vaccines out there, there might be still a worry about gelatine in the vaccines. What do you think? How can we get that message across?
I think it's important to note here, Kathleen, that the only vaccine with gelatin is the nasal flu vaccine.
Hmm.
And because it's such a small percentage of gelatin, it can be permissible to have the nasal flu vaccine. But if there's always a choice there, if some of the community doesn't want to have the nasal flu vaccination because of the gelatin content, then we do have the injection, the flu injection that they can have that does not contain the gelatin. And then just to kind of reiterate the message that no other vaccination that we give, apart from the nasal flu vaccination, all other vaccinations do not contain gelatin. So I think that's a really important message to give across today is that the only one that if they are worried about gelatin, it's the nasal flu that goes up the nose, but the ones which are the injections in the arms do not contain gelatin.
Mm. And we mentioned that maybe somebody would like to talk to you about this a little bit more. I think this is a good time to share your contact number or your contact details of where our listeners could contact you.
Absolutely. So they can call 0121 466 3410 or 3413. Those two numbers they can call. And they can also go on to the Birmingham Community Healthcare Trust website and click onto the immunisation page, and all of our details will be on there as well for each of our teams that we cover, the areas that we cover as well. So there's quite a lot of information on our website. But if they want to email us, there's an email address which is bchnt and .birmingham IMS, so Birmingham IMS at nhs.net. So if they want to get booked into any clinics, ask any questions, you can email or telephone call to us, and we can try and help you and support you with any questions or queries.
Wonderful. Listeners, that's 0121 466 3410. And if you forget that, you can ring in the studio and we'll give you that number out again. And the studio number, as usual, is 0121 772 8892. Because I know it might be difficult to grab all of that information, and but we will send that out to you if you've forgotten the number to ring in. And parents maybe just want to discuss something, as you said, about the flu vaccine or the nasal vaccine, and in relation to gelatin and what alternatives are there for them. You did mention that there was an injection, but some children might be a bit frightened of injections as well. Have you found that in your experience?
We have found that the children can be frightened of needles, but what we want to say is that our nurses are very experienced, qualified health professionals, and they have experience in dealing with the fear of needles. And we also send out a leaflet as well to for the appointment, which has got advice on there how to prepare your child for the vaccinations. And also, if the parent wants to attend with their child, they can get booked into our clinics and they can support their child on the day, because we do know the parent is not in the school when we vaccinate the child in the schools. But if we do offer the alternative that we can offer a clinic appointment to the parent to come along with their child to get their vaccination. So that's another supportive way of how we can support the child and parent to be there together at the appointment.
Which is great. And of course, all of this service is free for parents. And
Absolutely.
I know we mentioned that before the break, but we should stress that again, because in some countries you do have to pay for vaccines. So it's important to stress that it is free for parents here in the UK. Is there anything else that parents need to be worried about in relation to vaccines? You know, if the child has an allergy, does that matter? Or if the child has other illnesses, does that matter? What, you know, I'm sure all this is out, as you say, you do a lot of prep work beforehand. It's probably in your forms already, but maybe you could just explain to us, you know, what is in that form around this.
That's fine, thank you. So the Joint Committee of Vaccinations and Immunisations and evidence from multiple studies show that vaccines are safe for children if they have any egg allergy. So this is a common question that parents often ask us, if my child is allergic to eggs, can they have the vaccine? So we have got the information and the evidence to suggest that it's safe for any child that's got any sort of egg allergy. And again, if the child is immunocompromised, can they have the vaccination? So that's another common question that we get asked. So all children who are immunocompromised are safe to have the inactivated vaccinations. So the HPV vaccination is inactivated. The nasal flu and MMR are the only live vaccinations administered within the program, and these are not given to those children who are immunocompromised unless we have medical professional advice given to us. But we do steer away from the live vaccinations for anybody who is immunocompromised. And again, to reiterate the message, these vaccinations do not cost the parents anything. They are free from the NHS to give to your children.
A lot of information we've gathered today, and we probably have less than 5 minutes left now in the show. And I'm wondering if we're able to summarize kind of some of the key points that we mentioned earlier on in the show. We talked about Mavis. Maybe you need to explain that, what it is, and just to kind of an overview of what what kind of vaccinations are out there, just very simply, if you can.
So as we talked about Mavis earlier, Kathleen, it's our new e-consent platform. It's what sends out the messages to parents to give consent in the wintertime. That will be for flu. It'll either be the nasal or the injectable vaccine. From January to Easter, they'll get a consent form through if they have any children in year 8, and that will be for the HPV vaccination. And then from Easter until summertime, if they have children in year 9 or older children who've missed the teenage boosters, diphtheria, tetanus and polio, or meningitis, ACWY, they will get consents out for those vaccinations. They might also get one through the Mavis system for MMR, measles, mumps and rubella if it's been missed in childhood and they need a catch-up dose. And all the information regarding all of the vaccines, the websites, it'll all be included in that link for parents, and a number to contact each individual team if they need any more help or advice. The only way Mavis can do that is if the school supplies with parents' contact details, and that can really be a sticking point with some schools. But we are covered under the data protection regulations. All information is stored confidentially.
Wonderful.
Just add as well, sorry, Kathleen, that Mavis, the form that we have to, that is sent to parents, is a very easy form to use. And also, if the parent, say, does not want to have the vaccination, they must at least reply to a yes or a no, because what we do get is a lot of consents with no reply, whether it's a yes or a no. So there's no response from the parent whatsoever. So if they decide to have it or they don't want it, at least just reply a yes or a no on it, and that would let us know that actually this parent does not want it or this parent does want it. But just not responding is a huge issue as well in Birmingham and Solihull. So we would like that to be kind of a message gone out to parents. Please do at least opt in to put the consent in as a yes or a no.
Wonderful indeed. Parents, you're listening into our wonderful show today with Yasmin and Sharen giving up their time trying to get this information across to you, and how the system can work better for everybody. And as we mentioned many times, a free vaccination system here, and it would be great if you can reply to them. With less than a minute left in the show, I'm just wondering, is there any key tips, any key pieces of information or signposting that you want to mention?
I think it's really important to say as well that COVID vaccinations are not what we give in the school age immunisation service. And also, we've got some new links and new videos that we've created, and they're all on our Birmingham Community Healthcare Trust website. If you just go onto that website and click onto the immunisation page, you will find a load of information that we've created recently, new videos, new faces that you'll see on the videos, and that's got a lot of information for you to make that informed decision on having your child vaccinated. Thank you very much.
You're welcome. And just one last question. Is that information in different languages?
It is, yes. So you'll get the
Brilliant.
videos in different languages, and the booklet is in different languages. So the Asian languages, which is Urdu, Arabic, Punjabi, Sikh Punjabi, and what else did I say? Arabic, Sikh Punjabi, Bengali,
Bengali,
Gujarati.
yeah.
Yeah,
All
thank
those
you.
languages, wonderful. Well, thank you indeed. And that's all that the time is left to actually thank you both for coming on and giving such beautiful information, some powerful information, some life-saving information to our listeners this evening. Inshallah, listeners, please spread this information, and the contact numbers are there. Phone Unity FM if you forgot them. And it's just for me to say thank you to you both now this evening.
Thank you, Kathleen.
Thank you.
Listeners, do have a good week, inshallah, and tune in to us next week. Assalamu alaikum.